Unlocking Happiness, a guide to serotonin, depression, and reviving your joy. Imagine a world where every morning feels like a struggle, where the vibrant colors of life seem dull and happiness feels just out of reach. This is the reality for many facing serotonin deficiency. The connection between serotonin and depression is complex yet undeniable. Low levels of serotonin can lead to feelings of depression, persistent feeling of sadness, worthlessness, and hopelessness. Serotonin is often termed the feel-good neurotransmitter. It plays a crucial role in regulating mood, sleep, appetite, and even digestion. But when its levels dip too low, the effects can deeply impact your quality of life. Other symptoms of serotonin deficiency include feelings of depression, negative thoughts, cynicism, social withdrawal, anxiety, irritability, sleep disturbances, feelings of despair, and increased libido. The causes of serotonin deficiency are multifaceted. It can stem from genetic factors, hormonal imbalances, poor diet, chronic stress, and even wintertime. Dietary habits play a significant role, with poor nutrition contributing to decreased serotonin levels. Drinks that contain caffeine, aspartame, and alcohol can all deplete serotonin levels. Addressing serotonin deficiency requires a multifaceted approach. Diet is the first line of defense. Foods rich in tryptophan, an amino acid, can help boost serotonin. These include eggs, cheese, turkey, and nuts. Nutritional supplements offer another avenue for increasing serotonin levels. Supplementing your diet with either 5-HTP or tryptophan is a great way of increasing serotonin levels. Vitamins such as B6 and D3 have been shown to support serotonin synthesis. I'll leave links in the description to help you to take a look at supplement options. Medication, particularly selective serotonin reuptake inhibitors, SSRIs, are often prescribed to help increase serotonin levels in the brain. SSRIs work by blocking the reabsorption of serotonin, making more available for the brain to use. You should not feel embarrassed or ashamed to take antidepressant medication prescribed by your doctor. Lifestyle changes can also significantly impact serotonin levels. Regular exercise, adequate sunlight exposure, and stress-reducing practices like meditation can help boost serotonin naturally. It's important to approach serotonin deficiency with care. Consulting with a healthcare professional is crucial to identify the root cause and appropriate treatment. By addressing serotonin deficiency through diet, supplements, medication, and lifestyle changes, there's hope. It's possible to reclaim the vibrant colors of life, one step at a time. Remember, you're not alone, and help is available. If you are feeling despair and experiencing suicidal thoughts, then consult your doctor, a counselor, or the Samaritans immediately. We have more educational videos about health and well-being, so make sure you check them out. Stay safe and take care. Your health matters.